Good afternoon. It has been over a week since we returned to the transition phase. While the daily cases and the weekly infection ratio have remained stable, we need to remain vigilant. A new variant of concern, the Omicron variant, has been detected in several countries now. Very little is known yet about this variant with regard to its transmissibility, severity, and how effective vaccines are against it. We are closely monitoring the situation. Scientists around the world are working on it, and we will know more in a few weeks' time. While we have not detected this new variant among local cases yet, it is only a matter of time before it will arrive in Singapore. Therefore, we are making several pre-emptive moves to buy ourselves some time while we find out more about the variant. First, we will step up border measures to reduce importation risks. Over the past few days, we announced travel restrictions for affected countries in Southern Africa. We also deferred the launch of vaccinated travel lanes with countries which serve as travel hubs for the affected countries. We will continue to adjust our border measures based on our risk assessment. Second, we will enhance testing protocols to detect Omicron cases, and we will step up testing requirements for visitor arrivals. In addition, we will revert to PCR rostered routine testing for border frontline workers who may come into contact with travelers from affected countries or regions. This will start from the 2nd of December. Third, we will adopt differentiated and stricter public health procedures for confirmed or suspected Omicron cases. Such cases will be conveyed to the National Center for Infectious Diseases. We will also step up contact tracing to identify their close contacts so as to ring-fence any possible further transmission. We will continue to track developments in the Omicron variant closely. This set of measures that we have announced today will help us to quickly detect and contain cases infected with the new variant and help to reduce the risk of importation and further transmission. As more data becomes available in the coming weeks, we must be prepared to further adjust our measures if necessary to ensure that the situation remains under control before we continue on our reopening journey. We have made a lot of progress in dealing with COVID-19 over the past 2 years, including beefing up our healthcare capacity and putting in place the necessary healthcare protocols. I would like to seek your support and understanding as we adapt our measures to keep everyone safe. We will share more information with you as and when we know more about this new variant. Meanwhile, vaccination and booster shots remain our key defense against COVID-19. As we near the holiday season, I would like to urge everyone to remain vigilant, exercise social responsibility, observe the safe management rules, and test yourself regularly. Let us continue to work together towards COVID resilience. Thank you.
Good afternoon. Today, DMS Kenneth Mark and I will focus our presentation of how we are handling the Omicron variant. South Africa has strong capabilities and know-how to sequence and detect virus. They are detecting rapid spread of the Omicron variant in some parts of the country, particularly the Gauteng province. But it is likely also to be spreading elsewhere in Africa, it's just not detected. So actually the medical community here is very grateful to South Africa for their continued surveillance of COVID-19, alerting the world to this emerging variant called Omicron, and also a potentially dangerous variant. WHO has classified it as a VOC, a variant of concern, and this is mostly because of the relatively large number of mutations, 32 out of about 5,000, just on the spike protein itself. Yeah, so the spike protein has about 5,000 genes, and 32 have been mutated. And there is therefore reason to believe that Omicron may have fairly different characteristics from the previous COVID-19 variants that we know about. For example, is it really more or less infectious compared to Delta? Is it more or less harmful? Does existing vaccines work well against it or less well against it? There are no clear answers to these questions now. Scientists around the world are working hard to provide some answers in the coming weeks. So the situation we are facing is this. We have our known enemy called the Delta variant, which we have developed a set of countermeasures, honed them over time, and we are making good progress in living with Delta variant. And then we have an unknown enemy. And if this unknown enemy is indeed a lot more transmissible than what Delta is currently, Omicron could spread much more widely than Delta. Whether it would dominate the other variants, just like how Delta had done previously, is a possibility that we need to be alert to and watch out for. It's not definitive. Remember, in South Africa, the Delta variant is actually on the wane with fairly few cases, and then Omicron emerges. Nowhere in the world have we noticed a clash between these two variants. We also do not yet know if Omicron infection causes more severe illnesses. So in terms of potential timeframes, if indeed Omicron is more transmissible and begin to dominate over Delta, what kind of time frame are we looking at? We can draw a reference to the Delta variant. Delta took about 3 to 4 months to become the predominant variant globally, 3 to 4 months. So if Omicron is very infectious, it may be faster than 3 to 4 months. However, the spread of Omicron can also be slowed down because countries this time are a lot quicker in introducing border measures. So we are seeing US, UK, EU member states, Southeast Asian countries, including Singapore, Japan, Australia, Israel, all took swift actions to suspend entries of travelers from affected countries. This did not happen that quickly for Delta. So on balance, even if Omicron establishes itself and causes large epidemics around the world, we hope it will take a couple of months at least. And this period of a couple of months gives us valuable time to understand this variant, find out more about it, and put in place the appropriate countermeasures. During this time, we may see sporadic cases slipping through into our borders, and we want to be able to detect, isolate, and contain these cases. What we want to prevent and need to prevent during this discovery period is to prevent Omicron to establish itself in our community. Don't allow it to establish itself in our community when we do not know enough about it. And when we learn more about it, I'm confident we will learn to live with Omicron, just like how we have learned to live with Delta. So given that, our response now will be based on the following 2 principles. First, we will run parallel healthcare protocols. One for the known Delta, and the other one for the unknown Omicron. The first is to coexist, the second is to contain. And second principle, buy us time, at least for several weeks, to learn about Omicron. So these are the few things we are doing. First, quickly establish our starting point. So far, indications is that we do not have any Omicron infections in Singapore yet. We are testing travelers and air crew who arrived in Singapore over the past 10 days and have recent travel histories to the affected regions. There are over 200 of them. We have done 174 tests so far, and all are negative. Second, we will freeze all new VTLs and relaxations on social measures. and this is a prudent thing to do for now when we are faced with a major uncertainty. Third, we have implemented a new set of healthcare protocols for Omicron. We will continue the current healthcare protocols for Delta. As for Omicron measures, the healthcare protocols will be a lot stricter and quite similar to the initial protocols we implemented when we first encountered COVID-19. And everyone will be quite familiar with those protocols. But first, we need to differentiate the two kinds of infection, Delta versus Omicron. PCR tests continue to be able to pick up COVID-19 infections of all variants. But there is a particular PCR test that we have, supplied by Thermo Fisher, which goes beyond identifying a person as being infected by COVID-19. It can also indicate if the person is likely to be infected by the Omicron variant, because this is a particular difference in the gene dropout. So we will prioritize this particular PCR test on travelers. It is not foolproof, but the indicative result allows us to act faster and differentiate the healthcare protocols between the two kinds of infections. So if an individual is suspected of being infected by Omicron, he will be admitted to NCID. And if confirmed, will be managed there until we are confident that the person is non-infectious through repeat testing. There is no option of HRP for this group. We are also standing up dedicated isolation facilities for Omicron as a further option if we feel that public health considerations justify this. The swab samples from all these individuals will also be simultaneously sent and prioritized for viral genetic sequencing so we can ascertain if it is indeed an Omicron variant infection. And with every Omicron positive case, we will do what is familiar to everyone. We will conduct full contact tracing. Contacts will then be placed under quarantine and tested with PCR for exit. Third thing, we'll continue to push ahead with vaccination. This is absolutely the wrong time to argue that because there are new variants, let's not vaccinate and wait for a new vaccine. Absolutely the wrong time. People die because of such arguments and such decisions. Remember, when we are faced with unknown, we buy insurance. The insurance is now the existing vaccines. It is not a case where there are mutations and hence existing vaccines will not work, because the human body is much more capable than that once vaccinated. And there is a good chance that existing vaccines will work against Omicron. Doctors from South Africa have observed that amongst the Omicron cases with severe symptoms, 65% are unvaccinated, and the remaining 35% partially vaccinated. These are very brief early data, but it suggests that the vaccine could still be effective and underscores the importance of vaccines. If anything, it is a much more valuable insurance against a big unknown confronting the world now. So please continue to get your vaccinations and your booster shots. MOH will also continue to administer vaccines very proactively and leveraging our mobile as well as our home vaccination teams to reach out to seniors. We are making good progress in preparing for pediatric vaccination for those aged 5 to 11. We will announce details when ready. Fourth thing we will do is to learn about Omicron quickly. There are many aspects, but let me list 5 key aspects. 1, how infectious is it compared to previous variants? 2, what's the incubation and the infectious period? 3, can ART and other tests detect Omicron at the same level as other variants? 4, is it more or less harmful than Delta? 5th, how well do existing vaccines work against it. DMS will elaborate the work on this front and explain the implications of the answers to these questions. Finally, and fifth, border measures. For domestic healthcare protocols, we can use the Thermo Fisher PCR to preliminarily identify Omicron infections and differentiate the follow-up actions. But for border policies, there is no basis for us to do so. So this is where we need to judge very carefully and be prepared to adjust our border measures along the way. Minister Lawrence Wong will explain this. In conclusion, the situation we are facing is a bit like the game of snakes and ladders. We don't know what's the next throw of the dice and which square we will land in. If Omicron is more infectious, more harmful, and the vaccines don't work very well against it, then we have stepped on the snake square and we'll go down, and this will set us back by a long way. If Omicron is more infectious but turn out milder, then in time, a less harmful virus may dominate over Delta. And that is actually a positive development. Then we would have landed on the ladder square and maybe even take a leap forward in our transition to living with COVID-19. Many scientists, in fact, believe this is actually one possible natural evolutionary direction of viruses. Or it may be just another variant that makes no great impact. You land on the boring square, and we continue our current path to transit to living with COVID-19 as a resilient nation. We can only know the answer in the coming weeks. In the meantime, we should take a prudent approach and implement appropriate measures, contain Omicron, not let it establish itself in our community while we find out more about it. I will now hand the floor to DMS. Thank you.
Thank you very much, Minister. The WHO announced on the 26th of November that they were declaring the B11529 COVID-19 viral variant as a variant of concern, and this was given the new name Omicron. The label variant of concern refers to a SARS-CoV-2 viral variant which contains genetic changes that may be predicted or known to affect viral characteristics, such as its transmissibility, how it causes disease severity, the possibility of immune escape arising, whether as a result of vaccination or previous infection, diagnostic or therapeutic escape, and has been identified to cause significant community transmission or multiple clusters in different countries. These changed viral characteristics reflect an emerging risk of global public health concern, as they may cause a decrease in our public health abilities to control spread of infection, to prevent infection or at least a bad infection, or to treat COVID-19 infection and its complications. There were previously 4 VOCs, Alpha, Beta, Delta, and Gamma. Omicron is the 5th VOC to be designated by the WHO. The identification and designation of Omicron as a VOC has taken place over a very short space of time compared to the other VOCs. The recognition of Omicron as a new viral variant was thanks to our colleagues in South Africa, who have established a very impressive and extensive testing framework in their country. They discovered the new variant when a regional laboratory testing viral samples in the region of Gauteng noticed on the 23rd of November a high number of positive test results with an unusual genetic map, which had not been seen or reported before. And these were from test samples collected a week earlier. They rapidly alerted the public health authorities there. Confirmation of the test findings took place over the next 2 days, and the government in South Africa was informed of this new development on the 25th of November. The news was then released globally on the same day through the media, and the WHO's response came the following day. So, from the start of the discovery of the new viral variant to the public announcements, this took place over a 4-day period, which was unprecedented. We're very grateful to our colleagues in South Africa for their vigilance, as well as their quick and decisive actions to inform the rest of the world about the emergence of Omicron. Although we have some information about the nature of the mutations found so far in the Omicron variant, there's still much we do not know about this VOC. We know that the viral variant has a large number of gene mutations that has not been reported in a single viral variant before. From the genetic information submitted to the GI-SAID registry, we've seen at least 38 mutations identified in 11 gene sequences within the viral genome, with a staggering 24 different mutations so far affecting the spike protein of the virus. The spike protein is an important part of the virus, which allows the virus to bind to human cells and then facilitates the virus infecting the cells. So a change in the spike protein may change the ability of the virus to infect cells and cause its adverse effects. The spike protein is also part of the virus where some diagnostic tests, vaccines, and monoclonal antibodies are designed to recognize. So mutations in the spike protein may affect our ability to detect the virus and to treat it. Other mutations also exist, which affect other genetic sequences of the virus, and these too may, in their own way, change the behavior of the virus to differing extents. Given the extensive changes that are present in the genetic makeup of the Omicron variant, we believe this to be a distinct and separate variant in itself, and not simply an offshoot of other variants of concern, whether Delta or otherwise. We don't know whether its behavior will be similar or different compared to those other VOCs. And as the new variant gets progressively reported to be present in more countries around the world, we will have to find out more about Omicron in a few important areas. Firstly, is Omicron more transmissible or more infectious compared to other variants? We do know in South Africa, and in particular the area battling the Omicron community wave, like Gauteng in South Africa, the rate of increase of Omicron positive tests had occurred at a trajectory very reminiscent of Delta, when Delta first emerged and then took root in a community or country that had not been dealing with other viral variants. And in fact, there was a Delta wave that dominated community infections in South Africa earlier, but it had been on the wane in the last month before we saw the increase in Omicron cases. But it's not clear if Omicron is able to compete effectively as well with other variants or even with Delta if it's introduced into a country where Delta continues to be a dominant viral variant contributing to community infections there. In South America, the Mu variant previously had mutations that had similarly raised concerns about a possible increase in transmissibility, but it did not succeed in displacing Delta as the dominant viral variant of concern. So how Omicron takes root and spreads in various countries in the midst of dealing with a Delta wave is unknown. Most cases reported in different countries so far are imported cases, and we do not have enough information about community spread of Omicron outside Africa. Secondly, we do not know whether Omicron will exhibit an increase in what we call immune escape. And this refers to the phenomenon when the body is not able to adequately defend against a new viral variant despite already having pre-existing antibodies. The antibodies might have been generated due to a recovery from an early infection or previous vaccination. Immune escape leads us to see more reinfections taking place among people who had recovered from an earlier COVID-19 infection, or more vaccination breakthrough infections taking place despite vaccinations. And we do not have enough data at this time to tell whether immune escape is a concern for COVID-19, as many cases in South Africa were in unvaccinated people. But we are starting to see early reports coming in of cases arising in recovered persons. And we hope to get more information over the next 3 to 4 weeks to better inform about the transmissibility of Omicron, as well as whether previous infections or vaccinations are sufficiently protective. Thirdly, we do not know enough about whether Omicron will cause more severe infections compared to other viral variants. Early reports had suggested more people being hospitalized in regions like Gauteng, but this may be a function of the increased number of people getting infected rather than necessarily a function of increased virulence. We have also heard anecdotal reports of more people infected with Omicron having mild infections, like Delta. But we do know that many people infected so far with Omicron have been young people, and young people tend to have better outcomes compared to seniors. So it will take time for us to see more data that allows us to make this, judgments on whether Omicron causes more severe infections. In general, it takes a person getting infected and then deteriorating. It takes about a week or so, and then a little bit more time before they get really sick to need ICU care. So we may see more ill cases being reported over the next 2 to 3 weeks if Omicron is really more virulent. We will monitor the situation closely so that we can better understand what the impact is for us with regard to our utilization of hospital and ICU resources in Singapore should the situation arise where we have to deal with a local Omicron outbreak. Other reports have highlighted more children, particularly below the age of 2, being admitted into hospital in South Africa for treatment of Omicron infections. But it isn't clear whether these children were truly sick or whether doctors and parents were more cautious in admitting them to care for them. So there isn't enough data to inform whether vaccination effectiveness is affected. Scientists and vaccine manufacturers are presently engaged in studies to determine whether current versions of vaccines are effective against the new virus and whether tweaks in the vaccines need to be made to render them more effective. We hope these studies, as well as real-world data on infections occurring among vaccinated people and unvaccinated persons and their outcomes, we expect that to guide whether we should adjust our vaccination policies or not. At this time, the information we have leads us to believe very strongly that it is still reasonable to expect vaccinations to protect us against severe infections and death, and it will reduce transmissions in the community. We should therefore continue with our efforts to vaccinate as many people as possible, particularly our seniors, those with high risk factors for severe infection, and our young who are as yet unvaccinated. We hope over time to better understand whether Omicron infections exhibit the same characteristics as Delta or other variants. And knowing whether the incubation period changes and the rate in which an infected person clears virus from his body as he recovers will guide our public health policies and protocols and allow us to determine whether they need to change as we deal with Omicron. At this time, the early information we have suggests that in these areas, Omicron will behave similarly to Delta, and our present protocols remain effective and relevant. With changes in the genetic makeup of the Omicron virus, there will naturally be questions arising whether our present tests, whether they are antigen rapid tests or PCR tests, whether they are sufficiently sensitive to detect Omicron infections early. I know that test manufacturers are studying this carefully to see whether their test kits remain suitable, sensitive to detect Omicron, as they are for other viral variants. The early sensing for ART tests is yes, they are, but we will do our own internal validation as and when the opportunity arises. We are confident that the PCR tests that we have remain accurate and effective in diagnosing COVID-19 infection. Minister has mentioned about the TAC test kit from Thermo Fisher. This is one of the test kits we have available in Singapore, and it is able to detect what we call the S-gene target failure or the S-gene dropout, which may provide an early sensing that we are likely to be seeing an Omicron infection. This similar S-gene dropout was previously observed with the Alpha variant, but since we no longer see a dominant of Alpha infections globally, any such phenomenon seen on the test results is very likely to reflect the presence of an Omicron infection. This then becomes a reliable and accurate way for us to highlight those that we need to focus a lot more and carry out further tests to determine and confirm the presence of an Omicron infection. So in summary, we have much to learn about the Omicron variant. Whether it's more transmissible or not remains to be seen. But irrespective of whether the variant leads to a more severe infection or not, our current public health protocols and plans should be able to deal with the prospect of this infection arising in our shores. We are likely to see more countries reporting Omicron infections, and they may particularly be in countries where they have low vaccination coverage. There may also be a certain endemic incidence of Omicron arising, particularly where the countries may be less effective in their public health measures to control transmission and spread. What is important for us is to enhance our surveillance so that we are careful and we are able to pick up where these clusters start to emerge and where the risk remains for travelers to bring these infections across from any part of the world into Singapore. And therefore, it remains important for us to continue to enhance our surveillance, whether at the borders, whether we're looking back at travelers who have come from other countries, in the cases that we see in our community, and where we are concerned about the risk of Omicron infection, we will be offering whole genome sequencing as part of the phylogenetic testing we do for all these cases. We will keep warm our early warning systems and continue to engage in our external surveillance, looking at the developments very closely on the WHO front, what is happening in other countries, as well as the viral genetic information submitted into the GI-SAID registry. We will review our measures, protocols, and even the travel restrictions accordingly as the information evolves and is available to us. The community measures that we have put in place remain very relevant. Masking up, reducing unnecessary interactions, hand hygiene, and obeying the safe separation measures that we already have. And they will continue to be effective in protecting us against Omicron as they are against Delta. We will continue to vaccinate as many people as we can, and we will continue to safeguard our hospital, ICU, and community treatment facility resources in order to be able to have sufficient capacity if we do have to deal with both a Delta and an Omicron surge. The next few weeks are important to get the information we require. In the next 2 to 3 weeks, we may have more information about the ability of our tests to better detect the presence of Omicron infection. And over the next 3 to 4 weeks, we will have better sensing on whether Omicron causes more severe infections and whether our measures, particularly for vaccination, continue to be effective against Omicron. And this will allow us then to provide as best a protection for all our people against these evolving viral variants. Thank you.
Good afternoon. The situation remains highly fluid, as you heard from my fellow co-chairs and DMS just now, and there are still a lot of unknowns. It's a stark reminder that the pandemic is far from over. In dealing with such a situation, we know that border measures are our first line of defense against imported risk. But we also know from experience over the past 2 years of the pandemic that we cannot rely solely on border measures to stop the virus or to stop this new strain from coming into Singapore. Take the example of the Delta variant. Even the countries with the strictest of border regimes, like China and New Zealand, for example, have experienced the Delta variants in their countries. And so it will be for this new variant. The bottom line, or the more important point, is to recognize that border measures are really part of an overall system of defense. We require multi-layers of defense. Having strong border measures will help to buy us time, but it will not keep the virus out. It buys us time, and we must then use this time wisely to build up and strengthen other layers of defenses. What are these other layers? Well, you heard from the Minister Ong and DMS just now. We have to get our vaccines and boosters. We continue to ramp up vaccines and boosters. We continue with all that we have been doing on testing and tracing. These remains very critical, that ability to test, do contact tracing, and go in quickly to ring-fence any cluster that may be linked to this new Omicron variant. And then thirdly, all the basic measures around safe management that we have put in place, these remain vital. In many other countries, especially in Europe, they have now only started to reinstate some of these basic measures like wearing of masks, social distancing, or even controls in restaurants and F&B outlets. We have maintained these basic safe management measures throughout, and we should continue to maintain such a posture. So going back to border measures, there's a range of options we can consider. On the one hand, we can, on one end of the spectrum, we can continue with the status quo. Leave things unchanged, just continue with the status quo. On the other end of the spectrum, we can shut the borders and stop travel altogether. Of course, at this juncture, we should not under or overreact or rush to any of these extremes. In fact, there are many options in the middle of the spectrum. So we should judge the situation carefully and develop our responses based on data and science, as we have been doing throughout this pandemic. As a first step, what we will do is to strengthen our border measures through enhanced testing. And we will do so in several ways. First, we will require all travelers to undergo a pre-departure test within 2 days of their departure for Singapore. This is already done for most travelers, but there are some countries, the Cat 1 countries, where PDT, pre-departure test, is not required. So from henceforth, we will require pre-departure tests for all travelers within 2 days of their departure for Singapore. Second, all travelers entering Singapore, including travelers from all the different lanes, will have to undertake an on-arrival test at the airport. Again, some travelers already do that, but not all. And so from henceforth, we will require all travelers coming into the airport to do a PCR on-arrival test. Third, for the travelers on the vaccinated travel lane, when they come into Singapore, after the on-arrival test, we will require them to do 2 additional tests. These will be supervised antigen rapid tests done on day 3 and day 7 of their arrival. So these enhancements to the testing regime will take effect from 2nd of December 2359. Fourthly, we will do a one-off surveillance exercise for travelers who arrived between 12th and 27th of November. In other words, travelers who had come in earlier and they had traveled to the countries or regions that were affected by Omicron in the 14 days before their arrival in Singapore. We will go back to them and do a one-off, one-time surveillance test of all of these travelers. The travelers have been notified of their scheduled testing time and venue, and we thank all of them in advance for their cooperation and understanding. Fifth and finally, we will continue and in fact step up the rostered routine tests that we do for all our border frontline workers. And these are the staff, the employees who are working in the airports or the other sea and land checkpoints, or anyone working in the borders that may come into contact with travelers. We already have a rostered routine test regime in place. We will step that up, and we will have the staff undergo a weekly test using PCR. So these are the initial moves we are making to strengthen our border measures. At the same time, we will continue to monitor the situation overseas very closely. We will continue to gain a better understanding of this new variant, and we may very well take additional steps on our border measures as the situation becomes clearer in the coming days. So to conclude, throughout this pandemic, I think we have had to be nimble and quick in adjusting our measures to cater to a dynamic and constantly evolving situation. We are entering the 3rd year of the pandemic. I can fully appreciate that there will be a certain level of weariness, or fatigue, exhaustion that people feel hearing the news of this new variant. But I hope we can also draw strength from our responses throughout the past 2 years, how we have kept faith with one another and supported each other throughout this journey. And if we continue with that approach, we can stay united, rally together, and all do our part to get through this pandemic as one people. Thank you.
Thank you.
May we have the first question from Timothy Goh from Straits Times?
Thank you, Ministers and DMS. Now, PMB earlier said that we may have to roll back some of our measures. I'd like to ask, how likely is Omicron to lead to tightening of domestic measures, such as group sizes, given that our healthcare system has already been ramped up and many people have already been infected recently? Thank you.
It's too early to tell at this stage because we really do not know enough about this new virus. So for now, what we are doing is to take additional steps to strengthen our border measures. And we are not doing anything with regard to local measures at this time. But as I've mentioned just now, we need to have the mindset of being adaptable and nimble, recognizing that the virus, there will be new threats, there will be new information, and as in this rapidly changing environment, we will have to constantly review and update our measures accordingly based on new information. So for now, no change to our community posture and local measures. What we are doing is to strengthen our border measures with enhanced testing, as I've just described.
Next, can we have Yun Zhou from Zhao Bao, please?
Hi, good afternoon, Ministers and DMS. We have a question regarding the healthcare protocol surrounding Omicron variant. I'd like to find out, under what circumstances would one person be suspected of Omicron infection? Will it be chiefly through contact tracing? Because between identifying potential cases, suspected cases, and between from that point in time until results are out, would you mandate that this person has to self-isolate at home? As if I heard the Minister correctly just now, or do they have to be put in NCID? In that case, the question would be, will NCID have enough capacity, if indeed the Omicron variant were to turn out to be more transmissible?
Thank you very much for your question. At this point in time, we have a set of measures we put in place in anticipation for Omicron coming into our shores, but at this stage, we really don't have any case of proven Omicron infection yet. So right now, our attention still remains mainly at the borders, where we are looking at passengers, travelers coming into Singapore. They may be coming from countries where we know travelers come out from other places where there's a higher incidence of Omicron infections now, and therefore transiting through those other countries, they come to us. It's sometimes very difficult to predict where the trajectory is or the vector for transmission is, and it's wise, I imagine, for us to be vigilant across all countries coming into Singapore where travelers will potentially bring infection in. So that is one area that we are paying particular attention to. And those in the front line with close contact to these travelers become the next area of concern. And they are those where we are enhancing our routine regular testing in order to see whether we pick up any infections, whether in the airport or in any other places where they may have frequent and in close contact with such travelers. Then healthcare workers are an area of concern, particularly if they see such patients coming in with infection. And we continue to be vigilant with our routine regular testing for this segment of our essential service workforce. As and when any of these persons are assessed to be potentially Omicron infections, perhaps as a result of a PCR initial test that suggests the presence of an S gene dropout, these people will be empirically isolated for the time being, and we wish to isolate them well away from others in the community, as well as others who are infected with the Delta infection. This is a more cautious stance, simply because we don't know what the behavior of Omicron infection is and how it would be like when you put a person with Omicron infection mixed with other people with Delta infection. Will one super infect the other? Will that lead then to a different type of disease being present? In fact, these are unknowns, but as a precaution, we feel it's prudent to just isolate them further at this time, bring them all into a single facility so that we have a better ability to study them closely and then engage in our own local studies to have better experience dealing with Omicron infections. Our capacity at this time is able to accommodate cohorting all these patients in a single place, and as a result, we have framed our current protocol in this way. But our protocol may change over time as we have a better understanding of Omicron. If it indeed doesn't behave any differently from Delta, it provides us with an opportunity to change our protocols and therefore have them all aligned again, and we treat Omicron infections no different from Delta. But until then, it is more caution than anything else that drives us to be isolating these people separate from everyone else, and we use NCID as the dedicated facility for this purpose.
Maybe I just try to I try to understand your question, and I hope I got your question right. I mentioned the first thing we need to do is to understand what's our starting point. The starting point is, so far, we have not detected any Omicron infection within Singapore, which means life carry on as of now. Delta protocols carry on. No one in Singapore now needs to be affected. What we need to be worried about is the borders. So number two, the Thermo Fisher PCR test becomes critical, because not only it can detect someone to be infected, it can indicate is it likely to be Omicron. And we know that when we do a PCR test, the person has to be isolated and wait 8 hours, 6 hours for their test results. Yeah, so they're not going to run around. So if it's Omicron, then our protocol kicks in. It's not a new protocol. Actually, it's the old protocol from last year. Then you go to NCID, contact tracing will start, and whoever contact trace, go to QO. At some point, likely we have a leak, goes into the community, tested. Same thing if it's Omicron suspect, the person will go to NCID, then contact tracing will start, and whoever is a close contact, go back to HQO. So you have to imagine that we now have two separate viruses. It's as if we have two separate viruses now in Singapore. Actually, we do have two separate variants. So there will, if it happens, we'll have two separate variants, two separate set of healthcare protocols. One set for Delta, one set for Omicron. And the way to differentiate it is the Thermo Fisher PCR test.
Thank you, DMS and Minister. Next, can we have Si Xuan from Channel 8?
Hello, good afternoon, Minister. Can I request a Chinese soundbite from Minister on the level of threat or rather risk that we are facing from this emerging Omicron variant at this current stage? And my question is on the additional ART test for the VTL travelers. So understand that there will be additional tests on day 3 and day 7. Does this also include the VTL land, which we have arrangement with like country like Malaysia? And also another clarification.
Thank you, Si Xuan. Let's get to one question. Thank you.
Well, let me answer the second question on the VTL land link with Malaysia. We have always taken a risk-managed approach based on our risk assessment. If you remember, earlier on we said that before Omicron was identified, we didn't have on-arrival testing because of our risk assessment that I think it's manageable. Once we identified that there is a new variant emerging around the world, we decided to introduce a on-arrival test for land link. And this is a risk-managed approach because the overall risk in Malaysia is mitigated by the fact that significant restrictions were put on the Malaysians' own border to prevent importing Omicron variants into Malaysia. They have already introduced their own measures. On top of that, the land link between Singapore and Malaysia is quite different from the air link because it is currently restricted only to citizens and long-term pass holders, which means there are no foreigners will be allowed to make use of the land link. So there are various measures in place to mitigate the risk, and therefore the D3, D7 additional ART tests currently need not be applied to the VTL land link between Singapore and Malaysia. But we are continuing to monitor the situation, and we do continuous risk assessment, and if necessary, additional measures may be introduced. But currently, there is no plan to introduce additional ART tests for arrivals from Malaysia on land.
好，让我用华语讲解一下。我们现在面对的是两个敌人，第一个是我们认识的敌人，就是德尔塔 Delta； 第二个就是一个未知数的新敌人，就叫做 Omicron。这个新敌人我们有很多问题，传播力会不会比德尔塔强？杀伤力会不会比德尔塔强？现有的疫苗对它有没有效？这还是未知数。如果说这个 Omicron 新的敌人呢，会比德尔塔传播力强，久而久之成为所有冠病毒株的群龙之首，这要多久的时间让它能够称霸呢？我们相信德尔塔呢，经过了3-4个月过后，成为所有病毒的群龙之首。所以 Omicron 也许也是需要2-3个月的时间。所以如果真的是这样的话，这2-3月的时间是很宝贵的，我们要尽量用这个时间去了解它，去认识它，然后有措施去对付它，控制它。所以因为有这些原因呢，我们就在这2-3个月里面认识这个敌人，而且避免它在我们的社会里扎根，这是最重要的。所以我们现在的策略有2个大原则。首先，我们需要2套的医护程序，一套对付我们所认识的德尔塔，第二套是应付这个未知数的 Omicron。第一套是要共存，第二套是要控制。第二个原则就是尽量给我们争取更多的时间，最少几个星期甚至2个月，去了解这个 Omicron 的病毒。所以我们所采取的行动是以下了：第一，确定我们的起跑点。我们现在检测过好多个曾经去过被 Omicron 影响到的地方，我们检测了差不多174个人士，他们都是阴性的。第二就是小心为重，内部的这些条例的放松，还有 VTL 的扩充，小心为重，暂时停顿。第三，展开一套对 Omicron 的新的医护程序。我们现在有一个检测仪器，能够检测出这个人不只是被冠病所感染，也可以显示他是不是可能被 Omicron 所感染。所以这个检测器非常重要。如果检测可疑是被 Omicron 感染的话，我们有一套新的程序。其实说新其实是不新，这套程序跟去年的程序差不多一样。所以他如果被怀疑被 Omicron 传染的话，会到 NCID 隔离，然后我们会采取紧密追踪行动，然后紧密接触的人都会受到隔离，跟去年就差不多一样。所以有2套措施。第三呢，快点认识这个 Omicron 病毒，传染性多高，潜伏性多长，检测仪器还有没有效，杀伤力多少，现在的疫苗还有没有办法对付它，这些都是要我们的医学家尽快的去了解。第四，边界措施，我们已经非常快的展开了一些边界措施，所以那些被影响到的区域，他们的非新加坡跟非永久公民不能够进入新加坡。如果需要的话，我们会进一步的检讨需不需要绑紧我们的这个边界措施。很重要的一点，最后继续推展我们的疫苗行动。如果说现在有新的毒株，所以不要去接种，等新的疫苗出来，这就是大错特错。 这样的决定、这样的考量会搞出人命的。现在面对未知数的时候，最需要的就是买保险。最好的保险就是快点去打现在现有的疫苗，快点去接种。我们的医生呢，从南非伙伴那里拿到一些报告，数据显示，那些被 Omicron 感染的，而且病情比较严重的，65%没有接种过疫苗，剩下的35%接种过一剂疫苗。所以可见，虽然这个是非常初步的数据，但是显示出接种疫苗非常有可能还是有效的。所以请大家继续的去接种，继续的接受你们的追加剂。谢谢。
Thank you, Ministers. Next, can we have Si Hui from CNA?
Hi, Ministers and DMS. At what point might we possibly see ourselves back in the stabilizing phase? Because you mentioned that Omicron isn't here, but it will be here in a matter of time. So what are the preparations at the moment? Are we checking with pharmaceutical companies on updated vaccines? Would three shots be considered fully vaccinated? Is there a change in posture? I know there's not much data, but hope to get more information on this.
We are certainly looking to see how the science evolves and whether or not it requires us to recommend more boosters for people who had previously already had their full vaccination regime as well as the booster. Time will tell whether or not Omicron affects vaccine effectiveness in that direction, requiring us to do so. But until then, the existing information we have is that our vaccines still remain effective against all the viral variants. And we continue to work towards improving our vaccine coverage, ensuring that as many people who are not fully vaccinated yet have their chance to get vaccinated. And we're working with HSA to see whether it's possible to get a pediatric vaccine available for vaccinating those between the ages of 5 and 11. We've made previous announcements in that regard. We are also evaluating the therapeutic medications that we have brought into Singapore. We have a portfolio of different medications, some of which we have highlighted before, whether it's Regeneron, whether it's other medications. And we look towards procuring more of these medications, particularly if the studies show that they have demonstrable effectiveness against the new viral variants, whether it's Delta, whether it's Omicron. There are some concerns whether or not the monoclonal antibodies that have previously been made available around the world, whether as a class of drugs, these antibodies will be as effective for a viral variant like Omicron. But again, there are many scientists studying this right now, and we're watching the developments very closely before we adjust our procurement approaches when it comes to medications. So in short, we are taking all steps necessary, but we need to look at the data, the science. That will become more obvious and evident to us over the next few weeks. And as that information gets available, we will adjust our stance accordingly.
Can I just add? I understand our media friends, just like members of public, just like ourselves, we have lots of questions, and we wonder what will happen next, But the truth is, we don't know enough about Omicron to be able to have clear answers to those questions yet. So as of now, what we need is to implement this set of measures so that it gives us time to find out more about Omicron and at the same time prevent it from growing roots and establishing itself in our community. And that means, first, we have established no Omicron infections as far as we know. Second, freeze social restrictions, social relaxations as well as new VTLs. 3, proceed with vaccinations even more proactively than now. 4, implement the border measures as Minister Lawrence Wong has mentioned and adjust if necessary. And 5, on the scientific front, find out about all these answers. This is what we can do for now. The answers that you want, we also want, and that will take time.
Just one additional point to raise, which is, we are dealing with an Omicron variant, another variant of concern now. This will not be the last variant of concern. There will be new mutations, and we just have to be prepared. It may well turn out that Omicron may be not so threatening, a bit of a non-event. Maybe, we hope. It may turn out to be worse. But there may also be a possibility that another mutation down the road, later next year, turns out to be far more threatening, far more resistant to the current batch of vaccines. That remains, all of these, questions remain the broader uncertainty, throughout this pandemic, which we will all have to deal with. And it simply comes back to the basic point that there is no single silver bullet to address all of these issues. We need to be nimble, we need to be able to adjust quickly based on data, based on evidence, and we need to continually stay on top of all the different defenses that we have, whether it's vaccines, whether it is testing, whether it's therapeutics, whether it is the basic SMMs that we have put in place. And at the end of the day, it goes back to what we've always emphasized: individual social responsibility, in all of us doing our part, cooperating with the measures, and staying united in fighting this pandemic together. That remains the fundamental posture and strategy to get through this pandemic.
Thank you, DMS and ministers. Next, can we have Charlotte from The Economist?
Hi, thank you very much. On what basis will the government decide to start suspending VTLs?
We will have to look at the data, the evidence in terms of the spread of Omicron in the specific country where we have a VTL with. And if we think that there is a very strong likelihood, or we assess that there is a risk of imported infections coming through that particular channel, then indeed we will consider suspending VTL with that country.
Thank you, Minister. Next, can we have Chen Lin from Reuters?
Hi, good afternoon. Is Singapore planning to order more Thermo Fisher's PCR tests? And will Singapore do gene sequencing analysis on some past COVID cases to see if Omicron has already been circulating behind the recent surge? Thank you.
Thank you very much for your question. We do have a stock of test kits from Thermo Fisher, and at this point in time, we are further assessing our demands, our needs, whether or not we want to procure more. That would be a set of negotiations will take place with the manufacturer, but it first has to start with our own assessment whether or not we need more than the existing stock of test kits that we have available. We are doing whole genome sequencing. This is part of our phylogenetic testing framework. We do this for all cases where we have concern about identifying what the viral variant is. We had at one stage done this, in fact, routinely for all cases. And now we will be prioritizing those where we are particularly concerned about the possibility of Omicron infection, whether it's travelers, whether it's those in our frontline essential services who may have contact with travelers, and those who have secondarily close contact with eventual cases that we pick up in the community, or those who come in as imported cases as well. So we have a strategy in place which involves using whole genome sequencing, but at this stage, it's really a similar protocol to what we're doing earlier. We have not seen a need to adjust that particular protocol, other than to reprioritize to include these people who may have a higher risk of having Omicron infection.
Thank you, DMS. Next, can we have Naveen from Today?
Hi, I wanted to ask about the recent flight coming in on SIA. I think there was one Omicron case that was detected. 6 people are on stay-home notice, and 1 has been quarantined. Could we get an update on the health situation, please?
Thank you very much for that question. On the 29th of November, MOH was notified by our Australian counterparts under the WHO International Health Regulations framework that there were 2 confirmed COVID-19 cases that were diagnosed to have Omicron variant They had traveled from Johannesburg in South Africa to Australia. They had transited through Singapore at Changi Airport. They did not leave the airport. They were only in the identified isolated transit area, which was meant for which was dedicated for use of these travelers for onward travel. So we have not assessed significant risk of infection coming in at this point in time into Singapore. These two travelers had some contact with other travelers, some of whom have traveled on to other countries, and we have informed the relevant health authorities to investigate and make sure that those travelers remain in good health. But for those who did come into Singapore in the same flight, we had in fact implemented, before news of these these infected travelers from our Australian counterparts, we had already implemented a surveillance system for them, and 7 travelers coming into Singapore on that same flight were placed under enforced quarantine in our dedicated quarantine facility. They had to undergo on-arrival testing. All 7 tested negative, and they will continue to be tested on a regular basis, and only if they have a negative test will then they be allowed to exit the SHN that they are presently under. One of the 7 travelers was in fact within the 2-row normal formula that we use to identify potential close contacts on flights. And this particular individual has then been isolated away from everyone else, quarantined, and continues to be also on a regular enhanced testing regime. But all 7 of them tested negative on the arrival tests. They are all asymptomatic, and we continue to watch them closely to see whether they ultimately develop any features of infection or whether or not they ultimately will test positive.
Just to clarify, 7 of them entered Singapore, 6 go on SHN, 10 days, 1 close contact, go on quarantine. Yeah, so all this SHN quarantine sounds all very familiar because these are all the healthcare protocols that we used to adopt last year and early part of this year. So it's the same.
Thank you, DMS and Minister. Can we have the second last question from CKIT from CNA Digital?
Hi, Ministers. Thank you for taking my question. What concerns are there that the emergence of the new Omicron variant could have a major impact on Singapore's travel industry, given how we are just starting to see some signs of recovery for this industry? Thank you.
Thank you. Indeed, the travel industry has been suffering from the impact of COVID-19 over the last 2 years. We are beginning to see some recovery as a result of the VTLs. Now with the discovery of the Omicron variant, we are taking a more cautious approach with regard to the VTL. As we mentioned earlier, we have deferred some of the VTLs, new VTLs that are coming on stream. We have introduced additional test requirements, and I'm sure travelers will also be more cautious, and some may decide not to travel during this period of time. We are yet to see the full impact of this Omicron variant, and as we said, there's still a lot of elements of this variant that we are not familiar with. We are still discovering more information, and time will tell whether or not this Omicron variant is likely to have a further impact on the travel industry. But in the meantime, I think it is important for us to take additional precaution to limit or to mitigate the risk of imported cases. I think this is important for us, and it's also important for the long-term benefit interests of the travel industry, because we do want to ensure that if we were to open up for traveling, the travel can be done safely.
Thank you, Minister. Can we have the last question from Mayuko from Nikkei?
Yes, thank you. I would like to ask, what made you to decide this is not the time to shut the border for the travelers from foreign countries? There are some, while you are waiting more information, more data, there are some countries who decide to close it. And some of the, I wonder if some of the VTL partner countries may say that we don't want to do the VTL with Singapore because, you know, VTL, Singapore is continue to keep the border open.
Well, Japan, for example, has chosen to close its borders. I think Israel is the other country that has chosen to do so. I think every country has to make its own decision on what are the appropriate measures. In Singapore's context, we have always tried to explain that border measures have to be looked in the context of the overall system. It's not just borders alone. Border measures cannot stop the virus from coming in, ultimately. We know this from experience. Look at Delta and look at the countries with the strictest border controls. The Delta variant has still entered their countries. So what border measures do is help us buy time. And then looking at the situation today, we have put in place what we feel are an appropriate first series of protection, which is to enhance the testing regime, particularly pre-departure, on arrival, and then for the vaccinated travel lane travelers to have additional tests. We think this is a useful first step of strengthening of our border measures. We will continue, as I said, to review, and we may have to take additional steps based on the additional information we get, including information about the Omicron variant, as well as information about the infection situation happening in the various countries. The point that you were asking also about vaccinated travel lane, and whether, I suppose your question was, were we concerned about potential reactions from some of these countries in developing our border measures? That is not our concern. Our priority is to do what is sensible and right for Singapore based on all the data and evidence that we have, and to develop a robust set of measures both on the borders and within our community that will keep everyone in Singapore safe. That has always been the guiding priority throughout the pandemic. Our decisions, our measures have always been based on data, evidence, and science, and will continue to be so.
Maybe let me just add that it's important for us to remember that we have adopted a multi-layer approach of defense, as Minister Wong and Minister Ong explained earlier. Border measures is just one layer. On top of that, we have vaccination. We also have domestic safe management measures. And all these, as well as a testing regime, all these will work together to help to keep Singapore safe. So our measures are always a calibrated one, making sure that we are able to protect Singapore, but at the same time to continue to ensure that we strike a very careful balance between saving lives and saving livelihood. So I think that has always been our approach, not a single measure, but the whole basket of measures with a multi-layer of defenses. And that's our way to help to keep Singapore safe.